Hello, my name's Linda Stodgel, and my part was to describe where the role competency is in Hamric's core competency of APM framework. The word role may mean different things to different people, and depending on the context it's used in. Role may be defined as an expected behavioral pattern by an individual, or it could be defined as a job duty or function. It may refer to titles, which could be specific programs such as a certification or a job description. The word competency indicates that one has the ability or quality to function in a particular way, perhaps on a job duty. To combine role plus competency would lead one to the conclusion of having specialized training in a particular area. When looking at these definitions and at the conceptualizations for advanced practice nursing, it is reasonable to think that there may be some common components across all the APN roles and possibly an idea that could express that. It is from this viewpoint that Hamric's model of APN originates. The four advanced practice nursing roles, or clinical nurse specialist, the nurse practitioner, the certified nurse midwife, and the certified registered nurse anesthetist. APN is a concept with many roles, and Hamric's perspective was to apply the same core competencies to all the specialties, such as the CNS, NP, CMP, and the CRNA, because similarities exist, and all of these are presented in one model to introduce the integrated domain of competency. When examining the role competency of the APN, one must survey what makes the role go like to each of the four types of the APN. Examination of the primary criteria in Hamric's model reveals that all must have graduate education, certification, and practice focused on patient family or characteristics that contribute to the role competency. From this preparation, the basics are required to become a practicing APRN for all roles. The other component to role competency is done practice expansion, and this is accomplished through direct clinical practice, which is the central competency that all four competencies are built upon. It is through the development of these competencies that one begins to expand their practice and develop into a more specialized area. Direct clinical practice has several features that contribute to furthering the role competency, and these are the holistic perspective, formation of therapeutic partnerships with their patients, expert clinical performance, reflective practice, use of evidence as a guide for practice for all practitioners, and diverse approaches and interventions to health and illness management. Then you have to have your other core competencies mastered as well. So where are the role competencies in Hamric's core competency APN framework? As the nurse practitioner student chooses one of the four roles, the CRNA, the CNS, the NP, the CMM, and the population focus, they begin to acquire the knowledge needed, proceed through the primary criteria in Hamric's model, begin the direct clinical practice, and work through the features previously mentioned. Then they have initiated their role competency, and as the acquisition of knowledge and skill continues, the greater the role competency will be.